Have you ever heard of anyone talking about the change? Have you ever wanted to know exactly what is menopause and when does it start? If that sounds good to you, continue watching. Well, welcome back to my channel. For those who are new, my name is duPont. I'm a board-certified gynecologic oncologist, and I'm passionate about teaching women how to improve their lives, and I believe that begins with great health. So today we're going to talk about menopause. We're going to talk about what is it and when does it start. So in terms of menopause, it happens when your periods stop for 1 year. So we say after 12 months of no cycles, you've gone through the change. There are some blood tests that we'll check that can confirm that, but typically 12 months with no cycles is when menopause starts. Now, the typical age for American women is age 51. So when we think about that age, it's more of a bell-shaped curve. So half the women will be under 51, half will be over 51. I have had some patients that went through menopause in their late 30s, and that's usually termed premature menopause. But most women are around 49, 50, 51 is the average age for American women. And during menopause, you aren't able to get pregnant. So for some women, they're happy about that. They're happy to not have any cycles anymore. They're happy to not have the menstrual cramps or the bleeding every month. But for a lot of women, they're happy because they don't have a risk of getting pregnant. So that's one of the big things that happen when you go through menopause. Now, there's another term for menopause that I talk to patients about who are having surgery, and that's surgical menopause. Now, surgical menopause happens at the time of surgery when your ovaries are removed. So that may happen for, cancer condition, tumors on your ovary, whether they're benign or cancerous. So sometimes that will occur at the time of surgery, and usually it may be before the age of natural menopause. And so for those patients, their symptoms start abruptly. It can happen right away. I'll tell patients, you may notice the night after surgery, you start having some hot flushes. And some patients don't know what that is. Typically, I explain it that they'll kind of get warm all of a sudden, and it's brief and it goes away. So for surgical menopause, it will happen abruptly or right away. With natural menopause, it's more of a gradual transition where you'll start to have hot flushes, night sweats. They may start and stop, but eventually they'll start to increase as you get closer to that menopause transition. And during that 12 months when you're not having cycles, at the end of that, we say you've gone through menopause. Some women will talk about it as the change. So if you've heard that terminology, they're talking about menopause. Other things that can also cause menopause are chemotherapy-induced menopause. I have had some young women, particularly with breast cancer, who may have gone through treatment for breast cancer. Let's say they got chemotherapy and they went through a chemotherapy-induced menopause. I have had patients over the years that once they finish their breast cancer treatment and they've kind of healed from their treatment, their cycles may actually return. So chemotherapy-induced menopause may or may not be permanent. It depends on the chemotherapy agents, how long you're on chemotherapy, and kind of what age you started your chemotherapy treatment, whether or not you have enough ovarian reserve to have resumption of your normal cycles. And so we talked about menopause. The age is usually 51 for the average American women. But I do tell patients to talk to your mother or your sister, especially if you have older sisters, because you'll be more like the women in your family as in terms of when you go through the natural menopause transition. So what are some of the symptoms of menopause? Everyone's different. I do have patients who have very few symptoms and, it doesn't bother them. They don't need medications. They just go about their life. They realize that, their bodies are changing and they accept it. But some women have really debilitating symptoms where they can't function, they can't concentrate. So some of the most common symptoms are hot flushes. So you may see someone that's, fanning themselves, or they're getting hot and may start to fan themselves. That's really having a hot flush. It's very brief, and it's just where you feel like you're almost on fire, but it does go away. But a lot of women, it comes back frequently. I had one patient that was a school teacher, and when she was teaching her students, she started getting hot flushes, and it was just really hard to concentrate and really hard to focus on what she was saying because she started having, these hot flushes while she was teaching her students. So hot flushes are very common. Most women will experience them. Now, it doesn't affect everyone the same, but most women do experience them, and they can last anywhere from 5 to 10 years. Studies have shown that African American women do have hot flushes a little bit longer than others. We don't exactly know why that is, but just keep in mind that they may last for several years. And I have had patients tell me, I had hot flushes and then they stopped and then they came back. I've heard that enough that I do believe it happens. My mother, told me that happened to her. I don't know exactly why it happens, but it is very common. So if you have hot flushes that start and stop, just know that is a common experience among women. The other symptom that's just because they just didn't have restful sleep during the night. So night sweats are very common. Patients have told me they've had brain fog where they just can't concentrate. They feel distracted easily. Other symptoms are irritability, just being moody. I had one patient say, I just get really angry at my husband. He's done nothing wrong, but I just get angry and mad at him. Sometimes those are symptoms related to menopause. You may get irritable. You may have mood changes. You may just feel that you're different and that you're really short with people just because you're just irritated. And those are symptoms related to menopause. Not everyone experiences these symptoms, but they are common. Other symptoms that patients have told me over the years is dry eye. I've had some patients that notice, that their eyes are dry, and some people have to actually see their eye doctor because it gets so severe. I've had patients tell me they've had joint pain, arthritis, arthralgias, kind of achy joints, and they've noticed that with menopause. Vaginal dryness is another symptom that's very common. A lot of times it may interfere with sexual relations where it may be painful because you're so dry. If you do have that, definitely see your healthcare provider because that's very treatable. Those are the most common ones that I hear on a day-to-day basis and that I treat patients for. The hot flushes and night sweats and vaginal dryness probably being the top three. But then the irritability, the brain fog, those are very common as well. These symptoms are treatable. Some women are able to be on hormone replacement therapy, and some women aren't. So if you have these symptoms and they're distressing to you or they affect your quality of life, definitely see your healthcare provider because there is treatment available for you. There's non-hormonal therapies and hormonal therapies. So don't suffer in silence and don't think you just have to, tough it out and make it through. There are treatments that are available, and the treatments are very individualized. So I hope that was helpful today. We talked about menopause and some of the common symptoms that women face. If you have any questions, leave them in the comments below. If you have a symptom that maybe I didn't mention, leave that in the comments below. And thank you for watching to the very end, and I'll see you next time. Bye-bye.